Okay, we'll go ahead and get started. Hello, everyone. This is Bruce Shackman. If you have any difficulties accessing or hearing, please send a private chat to Michelle Pop, and she can help you. She's listed as the host. And I'm very happy to welcome you to this latest webinar for our CHERISH Research affiliates. I'm just going to give a couple of a minute or two of introductions, and then we can move ahead to our esteemed guests. So as you know, CHERISH is the Center for Health Economics of Treatment Interventions for Substance Use Disorders, HCV and HIV. And it's a multi-institutional center of excellence funded by NIDA, the National Institute on Drug Abuse. Our mission is to develop and disseminate health economic research on healthcare utilization, health outcomes, and health-related behaviors that informs substance use disorder treatment policy and HCV and HIV care of people who use substances. And we are a multi-institution collaboration among Weill Cornell, Boston Medical Center, University of Pennsylvania, and University of Miami Miller School of Medicine. But we are funded by NIDA as a national center of excellence, and our initiative to develop the research affiliate program, which is really blossoming this year, and develop programming for research affiliates who are experts in this general field and who we would like to get more involved in research, and particularly research funded by NIDA. This is one of our initiatives as a national center of excellence. So we're very glad to have representation on this call from investigators throughout the country and in Canada. So I'm going to introduce both of our presenters at the beginning so I don't interrupt them. First, Dr. Carlos Blanco is going to be talking to us about the HEAL initiative, which is, you've seen several announcements, press releases, and publications just in the last week. Just in the last week, I was in Washington on Monday representing the center on a discussion of one element of that, which is the Healing Communities study that Carlos and Sarah were both at as well. And there's a lot of activity going on, and I believe we'll hear from Carlos a lot of opportunities for health economics and health services researchers to participate. So Dr. Blanco is the director of the Division of Epidemiology Services and Prevention Research, known to all of us as DESPER at NIDA. He is a nationally known expert in epidemiology and treatment of addictive disorders with and without comorbid disorders. His accomplishments include, among others, a detailed examination of the course and stages of substance use disorders, the development of methods to quantify the generalizability of clinical trials, the development and testing of interventions that combine motivational interviewing with cognitive behavioral therapy to improve retention and outcomes in individuals with addictive disorders, and the creation of a virtual map of psychiatric disorders based on empirical data to guide research into the causes of mental disorders. Prior to joining NIDA, Dr. Blanco was professor of psychiatry at Columbia University Medical Center and a research psychiatrist at the New York State Psychiatric Institute. He's a graduate of the Universidad Autónoma de Madrid, sorry for my accent, and completed his psychiatry residency at Columbia. We also completed a research fellowship. He's authored over 250 peer-reviewed publications. Carlo will be followed by Sarah Duffy, who's going to talk to us a little bit more specifically about health economics research at NIDA and at NIH more broadly. Dr. Duffy is Associate Director of Economics Research in DESPER. She is responsible for the economics, opioid use disorder treatment services research, and quality measurement and management portfolios within the services research branch of DESPER, and advises on those areas of science across NIDA and NIH. Prior to joining NIDA, she spent 8 years as a senior research economist at the Office of Applied Studies at SAMHSA, where she used data from large national data collection projects, including the National Survey on Drug Use and Health, NIDA, and the Treatment Episodic Dataset, TEDS, to conduct economic and health services research on substance use treatment and costs. Prior to SAMHSA, she worked for the Maryland Health Services Cost Review Commission and the U.S. Agency for Healthcare Research and Quality, where she published several articles in the substance use treatment health services, and economics literature. She received her PhD in economics from University of North Carolina, Chapel Hill. Yay. Thank you, Carlos and Sarah. I think we're going to let both Carlos and Sarah speak and then open it up for questions, because there probably is going to be some relationships between those two. And if you are on the webinar and can submit your questions through the chat function to everyone, that would be very helpful so we can all see what the questions are. If you're on the phone and you can't, just raise your question on the phone. So with that, I'm going to turn it over to Carlos.
Hello, can you hear me?
Yes, we can, Carlos. Thank you.
Okay. Okay. So first, I wanted to thank you, Bruce, for accepting our money from NIDA to run such a wonderful center. I think that you really are doing fantastic work, you and your collaborators, and it's really great for NIDA to be able to allocate money for centers like yours. So thanks for doing the great job that you again and your co-investigators are doing, and also for providing service to people who can benefit from your mentorship and guidance. So I'm going to focus my talk a little bit on the initiative, and I think the main two messages I want to convey. The first of all is that the HEAL initiative is still evolving. So you should look at the website. There's a slide down on my talk about the website for the HEAL initiative. So you should monitor it periodically, because things are changing very rapidly. And so every week or every 2 weeks, there's going to be new opportunities and new guidance. So don't rely just on this talk for the HEAL initiative. The other thing is I'm going to present a relatively small deck of slides, because I wanted to have a relatively short presentation. But either Sarah or I will email you a longer deck. I think it's like 30 slides that NIH has put out, and I think that will give you more information. Part of that longer deck is the aspect of the HEAL initiative that is going to be more geared towards neurology and pain treatment. But it may be useful for you to look at it and see if there are opportunities that could be of interest. So as you can see, the first slide in the deck is Francis Collins Walker-Koroshets, who, as you know, is the director of the Neurological Institute at NORA. So I didn't put my name there because I wanted to make it clear that these are official slides from the HEAL initiative and not something that I have created specifically. I want to be very careful to try to be sort of as official as I can and provide the information that has been released. There are other things that are being discussed, but we are not necessarily at liberty to discuss all of them. So I will disclose as much as I can, but I think you also need to understand again that things are being discussed and will be released progressively, which again brings me to this idea of checking the website periodically. Next slide. Can I get the next slide? Okay, thank you. Yeah. Oh no, the previous one. Yeah, thank you. So the NIH strategy for the last couple of years for the opioid crisis has been built on these three sort of pillars or these three areas. One is pain management, trying to develop safer and more effective strategies for pain management, and especially strategies that don't lead to treatments that can be addictive. Then overdose reversal, which include more use of naloxone, but also potentially the development of more powerful and longer-lasting antagonists. And then treatment of opioid addiction, including new treatments, but also dissemination and implementation of the treatments that we have. And one thing that is sort of interesting about this slide is that now I didn't use another slide that NIDA has recently created that includes prevention. So I think that's interesting for two reasons. One is that prevention is crucial. As you know, only a minority of people who have opioid use disorder ever seek treatment. So treatment is not going to be enough. But so we need to do prevention. But the fact that it's not in this slide here, and this is the slide that we've been using for, as I said, for a couple of years, in a way means that prevention has become a little bit of an afterthought, and we are sort of catching up. That is in a way bad for public health, but the positive thing is good for researchers. So there's a lot of work that can be done in prevention that needs to be done for prevention. The work that NIDA has funded for prevention has been focused mostly in children and adolescents. Right now, we don't have any evidence-based intervention for prevention in young adults and in adults in general. So that's one of the things that we are going to emphasize, and I encourage you to think what could work and how to test it, and submit grants to us, because that's a desperate need that the country has. So the fact that, again, I mean, these are the three pillars that have been traditionally proposed by NIH, but prevention is gaining more and more ground, and I encourage you to think about that field. Next. So this is the outline of the HEAL initiative, which, as you can see, means helping to end addiction long term, and it's an integrated effort by NIH, where Congress has allocated $500 million to NIH to address this initiative. One of the important things to notice is that even though this is $500 million, this is only for this year. So the expectation is that these $500 million are going to be part of the NIH base, and specifically of NINDS, which is the Neurological Institute, and for NIDA. So, of course, Congress has to appropriate money every year, but the expectation is that this money is going to be ongoing. So it's not only a single bolus of money, but potentially a large increase in funding for research, which again is great news. At the same time, it's a great responsibility for all of us, for us at NIDA, but also for you as investigators, to make sure that we use this money in the best possible way to advance science, but more importantly, to save lives. And the goal of this $500 million is a combination of addressing pain, but also improving addiction research or advancing addiction research. Next. And so essentially, this initiative is going to have two tracks that are not necessarily parallel tracks. They are going to overlap to a certain extent, but it's good to think of them as two separate tracks. The pain management track is going to be led mostly by the Neurological Institute, so I'm not going to devote a lot of time to this, but as I said, in the larger deck of slides that we will send you, you can see some details that were developed by Walter Koroshetz, who is the director of the NINDS. NIDA naturally is going to focus on opioid use disorder, and as you can see, the main targets or the main thing we want to address is improved treatments, improved therapeutic approaches, including medications, but also potentially non-medication treatments. Then improve implementation and optimization of interventions. And then the third point is the neonatal opioid withdrawal syndrome, which is going to be a collaboration between NIDA and NICHD, which is the Child Institute. Next. This is a viewpoint that was published in JAMA, I guess, last week, and as you can see, it's written by Francis Collins, Walter Koroshetz, and Nora. And I just put this slide I mean, it's good if you have time, and I recommend that you do read this viewpoint. It's very short. But if you look at the tables, that sort of outlines what the main priorities are going to be for NIDA, at least for this year. No? So you can see that there's three main areas. One is new treatments for addiction, and you can see that there we're going to try to identify new targets for medication development, including new medications, but also development of vaccines. Then, as I had mentioned before, improving overdose reversal, and then developing treatment to address respiratory depression. In terms of implementation, there's going to be a large expansion of the NIDA, the CTN, the NIDA clinical network, and the expectation is that this year the increase is going to be about $29 million. So essentially, it's going to double the size, because the current budget of CTN is approximately $30 million. So this year, NIDA clinical trials is going to double, and at this point, the plan is to add sort of satellite nodes, but probably next year, if the funding continues as we expect, there may be an expansion, a permanent expansion of the node. So again, think about opportunities that will provide to you. Then we at DESPER are going to be leading a Justice Community Opioid Intervention Network, or JCOIN. And then the third track is going to be the healing community studies, also called Demonstration Project, which is the study in which Bruce, the meeting to which Bruce attended, and as Bruce can maybe discuss later on. I mean, there's still a lot of questions about how the study will be designed. So there's a great opportunity there, but also a lot of questions for what the priorities are in terms of outcomes, design, collaborations, and it's very exciting. At the same time, it's a complex enterprise, and I think it will give multiple opportunities to many of you to get engaged at different levels. And then the last point would be this treatment of opioid withdrawal syndrome, which, as I said, is going to be a collaboration of NIDA and the Child Institute. Next. So additional research priorities would be prevention, which as I mentioned before, even though it's listed as an additional priority, it's really a top priority for us because we don't have interventions and we very much need them. Then identifying biomarkers and improving precision treatments for addiction, development of non-pharmacological treatment, and then improving models of pain. Education is going to be also part of it, but it will probably have less prominence than the other aspects of the initiative. Next. So this is the website that I was mentioning before. And I realized that the URL is not here. So maybe, oh, no, it's here, it's here. Okay, so maybe you want to make a note of this website. And as I said, and I insist, check it periodically because that's where we are going to post the official information in terms of where the HEAL initiative is going and potentially the funding opportunities. One of the reasons we don't have the funding opportunities now, well, there's a couple of reasons. One is that we are still developing them and conceptually thinking what is the best way to proceed. But also for those of you who are not in the federal government, there's a lot of steps that need to be taken to clear initial concepts. And as those steps are clear, then we will be able to provide more information. But until we get all the clearances necessary, we cannot publish the information. Once that is published, it will be posted on this website. So the funding opportunity for the healing communities and the funding opportunities for medication, the funding opportunities for the Justice Initiative will be posted on those websites. And of course, you can email Sarah or me or the other people in the division, and we will be happy to give you the information that is available at the time. But this will be, again, the sort of the official place where you can find the information. Next. So this pilot demonstration project is the healing initiative, the healing communities study. So as you can see, it has different names, which can be confusing. It's called pilot demonstration project, but it will be a substantial chunk of money. It's going to be a large study. It's not going to be a small pilot study in just one country. It's going to be a large study. We don't know the exact budget, and we don't know the exact design, but again, it's going to be very large, so think big. And as you can see on the slide, the idea is that we will, hopefully in the next few weeks, be able to publish a funding opportunity announcement, and it will be a competitive process. And we expect that there's going to be collaboration between researchers funded by NIDA, partnerships with other federal agencies, and then collaboration with either state or county or some local public health officials. And the idea is that the idea is twofold. One is that the research is relevant for the communities, that the research questions are not just academic questions, but actually can solve the problems that are taking place right now. But also that at the end of the study, the interventions are sustainable. Even though NIDA has, a substantial amount of money, it's not realistic to think that we're going to be able to sustain the intervention. So we have to rely on other sources of funding, such as SAMHSA, Medicaid, HRSA, or other agencies to sustain the interventions that are proven successful. So the idea of this study is to start building these collaborations. And What exactly will be tested is will be decided both in the FOA, but also as people submit their applications, we will see what makes more sense to test. And the range of things that could be examined is prevention, interventions, screenings, pre-interventions, potentially treating comorbidity, increasing engagement and retention. So as you can see, the range of things that could be studied is very large. But the ultimate goal is obviously to decrease overdoses and also the prevalence of opioid use disorder. Next. And this is the now very well-known cascade of care. And I just put it here both because it's part of the official slides, but also because I think conceptually it's very useful to see where the gaps are and where we could intervene, and also see where, by looking at the size of these columns to see what is that we could have more impact. So think about the cascade of care as one of the conceptual frameworks of this demonstration project, and more broadly about how to develop interventions that could be funded by DESPER. Next. Okay, I'm going to actually skip this slide because this is about then the Justice Initiative, which we're also leading at DESPER. This will be led by Dr. Tisha Wiley. So the idea is that obviously one of the settings in which there's increased substance use is in the justice system. So we want to create a research initiative in which we can collaborate to develop better ways of treating and preventing opioid use disorder and potentially other drug use disorders in the justice system. Our idea is that probably in the first year we're going to prioritize giving supplements, but then later on, and probably also doing a survey of addiction treatments in jails. But eventually we want to probably develop some kind of collaborative endeavor. I don't know if it's going to be a network or linked TO1s, but we will try to create some kind of collaboration between researchers and also people working in the justice system so that we can, again, it's similar to what we want to do in the demonstration project, create interventions that can be sustained later on by the justice system. Next. And this is the last slide, which is a summary slide for you to have about which ones are the different initiatives. So I'm going to stop here and let's talk a little bit more specifically about economics, and then hopefully we will have a few minutes to have questions and go back and forth about the HEAL initiative. Thanks.
Thanks, Carlos. Oh. I'll go. Hi, can you hear me?
Yeah.
Hi, great. Okay, so I'm going to talk a little bit about NIH priorities for health economics research, and I'm going to talk about that, and then I'm going to talk about how you can, some tips on how you can determine if your application meets these NIH priorities. Then I'm going to talk a little bit about how NIDA is getting the word out about our interests in economics and other types of science, because it's changing a little. And then I'm just going to talk a little bit about the importance of the related notices section in FOAs, and then we'll move to the questions and answers. So this notice, clarifying NIH priorities for health economics research, came out in November of 2015, like the day after Thanksgiving. And the goal was really to tell the research community and others what NIH, the types of economics research that were still important to NIH. And the highlights from the notice, one of the things that the writers of the notice really wanted to convey is that health economics is still very important to NIH and obviously still supported. But that for NIH, given that its mission is to turn discoveries into health, the primary focus of any health economics study would have to be health-related behaviors, healthcare utilization, health-related outcomes, which I'm going to call on the rest of this slide, health, etc. And that it really had to be about an improved understanding of health, improvements in health, and other things. The other highlight of the notice is to note that it's critical that you talk to the PO of whatever institute and center that you're planning on applying to, because each institute and center may also have specific priorities and things they want to highlight within economics research. So as the notice talks about, there are specific high priorities overall for NIH. And really these have to do with both topics and also methods. So we're interested in economic factors that could influence health, influence the effectiveness of treatment, the choice of treatment, that kind of thing. Also important to NIH is trying to promote the deployment of the treatments and diagnostics and everything that result from NIH discoveries. And so that would be economics that can be done with or without implementation research and other types of research to really help the uptake here, including modifications, understanding where sort of the barriers are and what modifications may need to be made to facilitate broader deployment. The other thing is really methods that economics use. So one of the things that the science of economics can help with is understanding the real world effect of these discoveries on health. And this could be either the modeling that gets done, simulation modeling, or it can be in using sort of causal designs, econometric designs, to understand what's going on in the real world. The other thing, of course, is trying to understand, again, these factors that influence implementation, adherence, dissemination, and adoption of interventions. Another area that's very of interest to NIH is the whole area of behavioral economics and the other effects of incentives, either financial or non-financial, on health and the related behaviors. And finally, of course, there's an interest in the effects of social, economic, environmental, and other factors on health, and those would include policies. And so some of the policy analyses that economics can facilitate are still of interest to NIH. So what's outside? What are the kinds of things that probably we would not be able to fund? These are things, a lot of this is really, if you know economics, industrial organization type research. So just looking at productive efficiency when you're just looking at, say, producing the number of bed days or cost models or those kinds of things, where the output is not really a measure of health. Market concentration, prices, things where you look at, the effect of monopoly on things other than health outcomes would not be something we could probably would be funding. Also, if the outcomes are not health related, if there are things like general financial well-being or labor market outcomes without an explicit tie to health, that probably wouldn't be something that NIH could fund. And also anything looking at compensation or profits is just not something NIH is going to be funding. Also, something that is probably not going to be as easily to get funded, or any standalone economic evaluation studies that don't have a primary focus on health. If something comes in where the first aim is we need to understand the costs, and the second aim is we're just going to do cost effectiveness, we're not going to look at modeling health or anything else like that, that's going to be a hard one. And one of the things that's kind of tough about this is a lot of the applications where that kind of thing comes in, we have to return without review. And it doesn't happen that often, but my goal here with this talk is to make it happen even less often. So economic evaluation is something that's important to NIH, but it needs to be done in the context of a study that's looking at a health outcome. So one way to do that is alongside, say, clinical trials. It can be either one of the secondary aims when you first consider the trial, or it could be done as a supplement. And again, and this is true of any of the studies where the main focus is on health, you can add an economic component. The other place where we've things that have been successful are really modeling studies. So cost might be one of the things that you're modeling, but as long as your main focus is to model other things around, health and health behaviors and that kind of thing, that's something that we've been successful with. And Importantly, NIDA and NIH both are really interested in understanding more about what works best for whom, and modeling studies can be very helpful in that regard. And so we realize this is tough on the field, and so for NIDA at least, one of the ways you can find out if your idea meets the priorities before you apply would be just to send your aims to me, and I'll take a look at them. And the first thing I often do is make sure this is really health economics. Sometimes stuff comes in and it's from a sociological perspective or a psychological perspective. That's not economics, and it's not subject to this notice. And then I'll look at the aims and I'll see whether they conform with, in my view, with the NIH priorities. And if I think there's any kind of problem, I'll share it with other health economists at NIH to see. And often I'll even send it to the OD and just make sure that this is something we can do. And if in fact it is something that looks to me like we could do it, but the aims are written in a way that might not clearly show how they fit the priorities, I can offer to advise on writing the aims to make sure that it comes through clearly. And you're welcome to send me any ideas you have. It's always a good idea to get me in the loop early and come back, as often as you need if things change. I can always take a look at them. Other ICs have what is known as an economics point of contact, which is supposed to do this for their IC. So if you go to a different IC, you might start with your usual program officer and ask if they know who the economics point of contact is. They may well not, but if they don't know, I probably know, so you're always welcome to ask me. So that's it for the clarifying economics, but I look forward to your questions. But I did want to just reach two other topics. One is the way we're letting the field know about our scientific interests. What we're doing is we're reducing the number of program announcements that we have. And so we've set up this web page, NIDA Topics of Special and Continuing Interest. And this is the top of that page. If you scroll down, you'll see stuff like this. It has a list of the current topics. This isn't all of them. That's all I could fit on the slide. And also instructions for how we want you to apply. You want to apply with these things using the parent announcements. And also it's helpful to us if you could insert which DAT you were applying to just for our tracking purposes. But if you click on those things, you'll see a list of, it's kind of like a program announcement, the part that just tells you about the science. And the rest of the stuff is in the applications for the parent announcement. We still will have some PAs, and these are going to be generally things that require a special review or have a set aside, or where there's no program and parent announcement. So there's no parent announcement for an R34, so we still have our pilot health services parent announcement. So that's just a brief introduction to the DAT. Then I just wanted to go over related notices. So this is a section in every PA, again, we'll still have some of those, where we list all the related notices. You want to look at all of those whenever you look at a PA because it's important. And if you look down here, you can see that March 22nd, we published a notice of specific areas of research changes for this particular PA. And so if you clicked on that, that's one way to find them, is to look at the PAs, but you can also do a search at the notice of guides, NIH Guide to Grants and Contracts, where you can search for notices that might affect whatever it is you're trying to do, which is what I did here. But anyway, if you search on the notice, what we have here is a notice of the change to the specific aims. And what they do is they have the current language, which we used to say economic evaluations, including cost effectiveness and so forth. And then what we had to do was get rid of that. And so now they just have the revised language where it's not there, but we do direct you to the new clarifying notice. So it's a little convoluted to get there, but it's really important to look at those things. And so that's what I had prepared, but I'm happy to take any questions, and I'm sure Carlos is too. Thank you.
Great. Can you hear me?
Yep.
Yeah.
Okay, I didn't know if I was being muted. So it's Bruce. I'm happy to moderate. As we said, we encourage people to use the chat function or just start speaking. I'm gonna head off with one question or two questions, I guess, that occurred to me as you both were talking. One is, and maybe Carlos can give us the overview on this for the HEAL initiative. In addition, for NIDA's in the focusing on the clinical trials network, the criminal justice, and the healing communities, is there HEAL initiative funding that's going to be available for, traditional investigator-initiated R01s? You mentioned the area of prevention. There are other areas even more related directly to HEAL topics. Are R01s and other investigator-initiated grants sort of part of that additional amount of money, or is that not the case?
Yeah, that's a very good question. No, so at this point, my recollection is that for medication development, I think there's like $77 million that were allocated. For clinical trials network, the expected allocation is 29, and then for the initiative is about $6 million. For the healing communities, the amount has not been decided yet. So that's what we are planning on doing, and that's sort of, again, the expected numbers. But these are not hard numbers, and they can change over time. To answer specifically your questions, I'm not aware that any additional funding that will be allocated to R01s or R34s. At the same time, and this is my opinion, so this is not NIH official policy, but I would not be surprised, again, given how long how the dynamics of the HEAL initiative goes, if not all the money, let's say for the sake of the argument that the CTN is not able to spend all the money that was allocated this year, then it's possible that some of that money may be reallocated for other priorities. I'm not saying that's going to happen. I'm just saying that because this is evolving, that's a possibility. So I would encourage you to think potential applications that you would submit in case there's extra money, because if there's extra money, that will be announced, but there may not be a lot of time to submit the supplements or the applications. So that's one of the challenging aspects of the HEAL initiative, that because it's changing very rapidly, even when we don't know exactly how this is moving, And Bruce, you were there on Monday, so I think you also got the sense that this is still very much being discussed, and we're trying to move as quickly as possible, but there's still a lot of uncertainty about how we will move with the HEAL initiative. I know I haven't answered. Well, I haven't answered the question, but I think completely no. But I think that's the best answer we can give you at this point. I don't know, Sarah, if you want to add anything or give any nuance to what I said.
No, just that we still do R01s and stuff. So if you have good ideas, talk to me.
Great, Carlos, and Sarah, if you could just you mentioned a couple of times supplements, and that certainly seems like there's maybe some opportunity in the near term for supplements to existing grants, where maybe adding some health economics to an existing project that may not have had initially enough budget to include that. That sounds like that might be something that could be encouraged.
Yeah, I mean, I would say that that's definitely something that we could consider.
So maybe you could just talk a little bit about what the process would be for an investigator, let's say, who's aware of a study where they're interested. There's an interest in submitting a supplement. What's the process that because not everyone has had the pleasure of doing a supplement.
Right, so it depends. So the first thing is to talk to your program official. That's always the first thing. The second thing now is to see how much money the parent study has left over. Because if they have a significant carryover, say, then it may not be possible to get a supplement. But if you talk to your program official, they'll tell you, what they need in terms of an application. Generally, we like supplements to come in less than $100,000 total, That's not an absolute requirement, but if you're, for an administrative supplement, that just makes things easier to go through. And there's actually a link on the NIDA website about how you go ahead and apply that I can add to these slides, so you'll have them. But if you have to go over, just talk to your program official. So that's an administrative supplement. There's also, of course, the competitive supplements, but since this is a quick turnaround kind of thing, we're probably more talking about the administrative supplements.
Yeah, I mean, Sarah is completely right. I want to add, though, that for the initiative, there may be exceptions. So, for instance, we expect that for the Justice Initiative, there may be the possibility to submit administrative supplements that are over $100,000. I mean, as Sarah said, that's always possible, no? But in this case, it might be encouraged. We don't have the guidelines yet, so that's why we cannot give you more details. But again, that's why I encourage you to really look at the website fairly often, because for the Justice Initiative, that would certainly be a possibility. And I'm not sure how the healing community study will be deployed, but I would not be surprised if in the first year there's also the possibility of asking for supplements to start developing some of the technologies or get some of the data that may be needed. So what Sarah said is true in general, but I think for the HEAL initiative, I would also be on the lookout for the possibilities of larger supplements.
Great. So there's a question that I'll just read out from Sabrina Asumu, and she can pipe up if I misread it. But she's wondering about whether there's a focus or interest in infectious diseases, complications of opioid use disorder, for example, HIV and hepatitis C. Are there still funds set aside for HIV-related priority research, high priority research, and particularly thinking about recent outbreaks of HIV and hep C among people with a history of opioid use disorder?
There's no, I mean, of course, NIDA has a set aside for HIV every year. As you know, the HIV, the money that is dedicated to HIV is about 1/3 of NIDA's budget. For this year, most of that money has already been allocated to projects and to grants. So there's not a lot of HIV money left. And the HEAL initiative doesn't have any specific money for HIV. So it is possible that as part of some of the initiatives, like the CTN expansion or the demonstration project or the Justice Initiative, infections may be part of what is studied. I do not expect that would be the main outcome that we are going to study. The focus of the three initiatives is going to be probably more decreasing overdoses and decreasing the prevalence of opioid use disorder. And so we recognize that infections and other comorbidities are important. And so, we will be receptive to supplements or applications that address that, but that's not going to be probably the top priority of what we do. So, just to be specific, if we get two applications that have, or two supplements, but the two applications have the same score, and one is focused on overdose and the other is focused on Hep C, I think that in most cases, most likely we're going to favor the one on overdoses. I mean, that's a very general comment, so we look at every application individually, but I also want to give you some guidance about what the likely priorities are going to be.
Great. Catherine has a question which I would like her to just state because I don't want to misstate it. Catherine, are you unmuted?
I think so. Hi, can you hear me?
Yes, you are. Yeah. Mm-hmm. It's
Yeah.
Catherine McAllister.
Yeah, hi. Thanks very much for your talks. So we were just at CPDD, and I guess Nora spoke a little bit about HEAL, and she had one bullet on the importance of cost-effectiveness analysis. Do you think that just with respect to HEAL specifically, that maybe the priorities would change a little bit in the context of that initiative?
Sarah, do you want to address
Sure,
that?
yeah. Yeah, I think that that would not, doing cost effectiveness analysis alongside something like the HEAL, where you're trying to really come up with interventions that improve healthcare, that wouldn't be a change in our priorities. That solidly fits within the NIH priorities and really trying to understand that component. So I don't think it would change priorities, but again, it probably wouldn't be a standalone thing. It would be encompassed within whatever the overall application was.
Okay. And then a second question, if I can tag on to the first one, is just to, maybe Carlos mentioned this, but I may have missed it. So I understand that the focus this year, so for fiscal year 18, is really on these administrative supplements. Am I to understand that there may be specific PAs that are developed that would be coming out in future years related to this initiative?
Yeah, so we're working very hard to develop the funding opportunity announcements for all the aspects of the HEAL initiative. I expect for the Justice Initiative, what we will be able to do is probably give supplements, and then for FY19, we'll be able to probably accept applications. I think for the healing community studies, I think they might be able to even give some awards in this first year, no? But again, part of we have sort of two levels of difficulties. One is that we have to write the FOAs, but then once they are written, they have to be approved by different levels of government, no? And that delays things. So again, that creates uncertainty about when things will be published. But we hope to be able to give you more formal guidance in the next few weeks.
Okay, thank you.
I think it probably may also be helpful to address the CTN opportunities. Do you want me to do that, Carlos, or do you want to do it?
No, you go ahead.
So our center has been supporting in various ways several of the CTN studies, and they review clinical trial or observational study concept sheets, and then move them forward for funding within the funding parameters. And there's a process within CTN, but it's not the same process as submitting in response to a PA. And so many of those concepts are now being developed and going to be moved forward since there's additional funding. And there are opportunities to, consistent with how Sarah described it, to do economic evaluation alongside some of those studies. If you have interest in learning more, I would say contact. We can provide you with contacts as well as help provide some guidance if you contact our center. Any other comments on that, Carlos or Sarah?
Nope.
No.
Any other questions, folks on the phone? If you are, I guess why don't we just unmute everyone and we'll see if anyone, because people may be muted. Go ahead. Hello? Oh, maybe that wasn't such a good idea. Okay, I think we just unmuted people who were not on the webcam, but we can mute them back now if there's no question. All right. Well, I'm gonna. If you think of other things as I'm talking, I'm just gonna provide some closing thoughts. First, thank Carlos and Sarah for their presentations. This has been great. We will get the larger deck from you and post a link to it on our website. We'll also be sending a copy of this webinar to NIDA and determine where that should be posted. We're going to follow up with everyone who's been on the phone or on the webinar with an email very soon. We're asking for your evaluation of the webinar, so that will help us guide us going forward in terms of how to do this. We have future webinars under development, and the next one will probably be in September. One other just note for those of you who are on the phone is that our pilot grant and training corps has the opportunity this year to do some additional, to issue a call for proposals for some additional small applications in the $5,000 to $10,000 funding range, and this call for applications is open to investigators outside of our core institutions as well as inside. The investigators just have to have a sponsor who's a research affiliate or a member, one of the center investigators. And really we're focusing on, and this is kind of very much along the lines of what Sarah talked about, identifying studies that are ongoing where there can be, we can support some enhancement of health economic research as part of that ongoing study. And this would be a 6-month award, but it's enough to, I think, provide a little extra help to maybe then potentially could lead to development of a supplement or a separate type of award. And we're particularly interested in emerging adults and youth, as Carlos talked about. There's really not much research out there on that transition to young adulthood, and both on the prevention side, but also on the treatment side. The letter of intent submissions are due July 23rd, and there's more information about that on our CHERISH website. So with that, I'm just going to open up one more time to see if there are any questions. And if not, maybe Carlos and Sarah, any closing thoughts?
Yeah, I mean, this, as I said, is a very exciting time. At the same time, time of great responsibility. But one of the things is that the HEAL initiative is still sort of taking shape. So there's an opportunity for, in a way, advocacy. I mean, we are proposing the things that we at NIH think are going to have the greatest impact, but you as investigators can also raise your voice and tell us what you think would be most important to do. So we're always receptive to the ideas, and to the extent that you think that certain things are not being paid enough attention, you have the opportunity to help shape the field. So initially, prevention was not being one of the main aspects of the HEAL initiative. Now it's become much more important, but the same way that prevention has become more important, there are other aspects that we may not be thinking about, then if you advocate for them, might become important. So I would really encourage you to not be strident, but be vocal about what the priority should be, and let us know so we can engage in a dialogue about it.
And so, Carlos, what would be the best way for investigators, researchers to express those thoughts?
Well, I mean, certainly one of them was today's webinar. You can also do it through council. And another thing, I mean, another way would be to write, opinion pieces in journals. You can also communicate with us directly through email. But I think if you write something, let's say in American Journal of Psychiatry, JAMA Psychiatry, JAMA, expressing your views, that can be very, very influential. So that's the way I would do it. If you send it to me, I'll certainly take it into account. But I don't want to get necessarily like 100 emails. But if you write a piece, several of you, I think that's probably the best way to influence the field. Either a piece in a journal or through council. I would say those are probably the best ways. What do you think, Sarah?
That sounds right. To me too. But I'll also take your emails.
I guess Sarah's more generous than I am.
That's really helpful insight, Carlos, to think about that way. And certainly, if there are people who are interested in that, our Dissemination and Policy Core has experts who are good at dissemination to non-research audiences or to research audiences that are not familiar with the health economics terminology or the type of work that we do, where we need to do a little more translation before we can get our point across as to why we're advocating for our kind of research. So again, reaching out and contacting us, we can potentially find people within our center who can assist in that process of viewpoints, perspectives, and other kinds of non-traditional research articles. Great. Well, thanks everyone for participating. Thank you so much, Carlos and Sarah, for taking time to do this with us, and we look forward to further dialogue.
All right. Thanks for organizing it.
Thanks very much, Bruce. Bye, everybody.
Okay. Bye-bye.
Bye, everybody. Yeah.